Hello, my name's Allison Land. I'm Commissioner for Virginia's Department of Behavioral Health and Developmental Services. I am so honored and pleased to welcome you today to the 13th Annual Women's Wellness Celebration. This year's theme inserts the critical topic of mental health into conversations about these unpredictable and anxious times that we are currently living in. I'm grateful you're willing to dive in and have these important discussions about mental health right now. This is something I know we can all relate to. And it's something that, as you can imagine, we've been talking about quite a lot at DVHDS. Even under normal circumstances, we don't have enough conversations around mental health and the stigma that surrounds it. During National Suicide Prevention Month, which occurs every September, it's important to highlight that suicide is the 10th leading cause of death in the United States and the second leading cause of death for young people, age 10 to 34. According to NAMI, in 2018, 1 in 5 adults experienced mental illness. And when you expand that to include all the people in those adults' lives, their family members, their friends, their neighbors, and coworkers, there's not a single one of us whose life has not been touched by these issues. And we should be having these conversations regularly and without judgment. As you know, this year has added additional stressors. COVID-19 has changed our lives in so many ways and left many things uncertain. Those changes and uncertainty can lead to feelings of anxiety, stress, grief, and loneliness that at times can feel like that they're impossible to overcome. But as Mr. Rogers once said, if it's mentionable, then it's manageable. So talking about these feelings and being open about them with the people in your life is a great first step towards managing those feelings and practicing self-care. And if you don't have people in your life to talk to, there are still resources out there. Earlier this year, DBHDS received funding from SAMHSA for a COVID-19 behavioral health warm line, which we call Virginia Copes. You can call or text Virginia Copes at 877-349-6428, 7 days a week, and you can talk to a trained listener about what you're feeling and be connected to resources if you need them. We've already fielded about 550 calls to the warm line in the weeks since it was set up, and demand for the warm line and other mental health services is only anticipated to increase. I say that because we know that the health, economic, social, and psychological impacts of COVID-19 are already being felt in communities across Virginia and the nation. In Virginia, DBHDS and other partners asked pediatricians and family doctors about the impacts of COVID-19, and 88% of them said that they are seeing more of their patients present with mental health symptoms than prior to the pandemic. You may also have seen in the news this week that non-fatal opioid overdoses at a Richmond hospital are up 123% since COVID-19 started. We must press forward to answer this call. DBHDS has several community behavioral health programs already underway that are working hard to address these issues. We've also received over $2 million in federal grants to help respond to the behavioral health impacts of COVID-19. We are working closely with state legislators, locally run providers of public behavioral health services, called our Community Services Boards, or CSBs, and private providers of services statewide to make sure that mental health services that the people need and rely on remain in place during the entirety of this pandemic. Finally, it's such an important reminder that social distancing that has come with this pandemic can make us feel alone, but it's so important to remember we're all in this together. It's also so important to remember our essential workers, including our frontline healthcare workers. As an agency that operates 12 behavioral health facilities across the Commonwealth, our frontline workers and the individuals they help us serve are always first in our mind. If you're a frontline worker, we thank you And if you aren't, I'd encourage you to reach out to a frontline worker in your life and check in on them. The same goes for teacher, clergy members, and other community helpers whose lives are dramatically different because of COVID-19, but they are still being relied upon by so many. Talking with each other and checking in is not a cure-all and certainly not a substitute for treatment, but it's a great first step and one that is more important than ever. Thank you for being here today and for having these important conversations. I hope you have a successful virtual celebration and that the rest of your year treats you well. Thank you.